Well, good afternoon. I'm Christopher Robertson, coming from the law school, and sharing some unpublished joint work. So you all owe me some feedback after this. Ideas to explain the mystery you'll see at the end, please. It really builds on some work I've been doing throughout my career that culminated in this book from 2019 about why in the United States our health insurance is structured around leaving people exposed to huge copays and deductibles and uncovered costs. They really create this phenomenon called underinsurance, even for the 90% of Americans that do have health insurance coverage. And so we have really trained Americans to think twice about getting any health care. And I'll note this is even after the health care has crossed through two other gatekeepers. The FDA, for example, might not even let a drug onto the market, but if it does, your physician might not prescribe it for you. But even if he or she does exercise her licensed authority to prescribe this drug for you, the insurance system still says, wait, are you sure it's worth it for you? Maybe you want to second guess those systems. And that's inherent in the American healthcare system that's really trained people to second guess, to be wary of healthcare because it might cost you out of pocket. And you can imagine, in another talk, I can give you the consequences of that baseline, but here I'm here to focus on the exception to that rule, because the Affordable Care Act that President Obama signed made a big exception that said for certain preventative health care services, we want to eliminate those copays and deductibles. We want to require insurers to cover them, and we want you to be able to get them without any out-of-pocket costs. And so the question from a policy perspective is, how well does it work to have this big overarching system from which we carve out this handful of services where we're going to flip the rule? And we'll be focusing on three of these, and given the theme of today, across the lifespan, I made this pretty graph for you. Cervical cancer screening applies to people at one age range, colorectal screening another, and breast cancer screening mammography is to a third age range. Depending on your sex or gender, or sex, I guess in this case, and your age, you are due for one or more of those. And we know that about 25% of Americans are not up to the required screenings or the recommended screenings for each of those, even though they're free under the Affordable Care Act. When you ask people, as we did, recruited about 1,500 people that were needed at least one of those screenings that was recommended for them, but they didn't have, 80% of them said going to the doctor or hospital can be dangerous financially. 65% said the American healthcare system is full of tricks and traps, and 91% believe that in America, healthcare is never really free. So those are their general attitudes. You can see why it was kind of casting a shadow even over their preventative healthcare services, which are supposed to be free. And when we asked them about all their different reasons, well, why didn't you get the screening that was recommended for you? One of the most common answers was, I was worried about the costs or coverage of it. Again, even though the law requires for it to be free. So I'm really more excited. Surveys are exciting, but I'm even more excited about interventional research. So we did a survey experiment here that would hopefully lay a groundwork for a future field experiment, a clinical trial. And we randomized people to either get this notification that, hey, did you know that this care is actually free for you under the Affordable Care Act, because we'd already screened, we knew they were covered by insurance. And we found that if we gave them that information, people were significantly more likely to then say, please give me a link to schedule my screening now. So we found that intervention worked on average to increase this health behavior to get screened by about 5 percentage points. And we saw especially large effects for cervical screening and colorectal screening in particular. Contingent on getting that information that it'll be free for you, those respondents were 10 percentage points more likely to say, let me get screened. But we found this strange, non-significant backfire effect for mammographies. We actually found that giving them the information that it would be free didn't increase their likelihood of taking that behavior. It actually went the wrong direction non-significantly. So this is our mystery as to why people respond to information about the care being free differently, if that is not just a statistical artifact. Thank you.